Watch out, it's a live mic.
This is Mark McNease in New York City, and you're listening to another edition of the Live Mic Podcast. Welcome to the podcast, everybody. This is Mark, and I have my recurring guest, also my sister and Master Herbalist, Cathy McNease, on the line, all the way from Ojai. Cathy, how are you?
Hi, I'm well, thanks.
It's a little bit warm in here. I know you and I usually talk a little bit about that sort of thing, and we just had a heat wave, and I know that fall is coming, and I can't wait. I'm looking forward to some 70-degree days.
Yeah, I understand. We are just about to get to a heat spell where it's going to be probably at 100 for a couple of days. But here, by about September 8th or 10th, the nights get cooler, so there's at least a relief, even if it still stays hot in the day. So fall's just around the corner.
Yes, and I'm looking forward to it. Now, tonight we're going to talk about something that matters to me. Everything we talk about does, but some issues are affecting me personally at the time. And I've noticed that my hip, it's like especially my left hip, and I know it's my hip. It's not a muscle. It's my hip. I can just tell that. And so then, of course, I start thinking, do I have arthritis? Do I have some degenerative thing? So tonight we're going to talk about joints and bones.
Joints and bones are two areas that our aging population, and I'm older than you. I'm 64, so I have this challenge as well. We're dealing with. So there's a number of nutritional things that can be really helpful and not that difficult to put into one's routine.
Okay.
First, let's look at the most obvious things. If the joints are compromised on account of you're carrying too much weight, that's one of the first places to do what you can. And like we were talking about earlier, neither of us believe in that idea of you're powerless. And so you're not powerless if you're a fat person out there. You just need to take a little bit more control of your eating and your exercise. And I'm not speaking from an arrogant place. I'm speaking from the place of a person who has dealt with weight issues in my life. But I found recently, since last October, having lost 30 pounds, it has made a huge difference on my hip issue, which was very severe prior to that. So losing weight is one thing that may be of help. So get yourself pointed in that direction. A second thing is look at your diet and see what is inflammatory. And a lot of it just takes common sense. If you're eating a lot of processed foods and sugar and coffee and alcohol, all of those can be inflammatory if you're doing them in quantities. So reducing those inflammatory foods as much as possible, and then increasing some of the nutrient-dense foods that we're going to talk about today. So as many colorful fruits and vegetables as possible will be one of my suggestions.
Okay.
Okay, so from the point of view of Chinese medicine, which that's where my training is, we are looking at a decline in the liver and the kidney organ systems, as those are the ones that relate to the joint health and the bone health. And as we age, those two organ systems become depleted, and as a result, the joints can degenerate, and we have poor circulation in them, and then the bones can become really weak, porous, and easy to break. So there's two foods that I want to talk about and at least introduce our readers to that if we were doing a health news program, these would be two of the foods that are particularly in the spotlight lately in the healthy foods community. One of them is fermented foods. And there's a fabulous book which I purchased recently that's called Fermented vegetables with all sorts of interesting recipes, and they're things like sauerkraut and kimchi, but more than just the things that we're used to putting in or having in sauerkrauts. And the reason that the fermented foods are of such great benefit is they improve the flora in the digestive system. So they improve your digestive qi. One of the problems we see in the aging population is we have less digestive enzymes. So we have less ability to digest our nutrients, which also translates to we don't break down minerals so well. And then our joints and bones suffer as a result. So getting some of those fermented vegetables in the diet is a great idea. You can also get drinks like cultured kefir drinks or cultured yogurt. I know yogurt's one of the cultured foods you eat on a regular basis. Me too. I think it's a good idea to get a variety of those various different cultures to make for very healthy gut health. So if you go to your even large grocery store, it isn't just in health food stores anymore. Now it's pretty widespread. You'll find a variety of very interesting fermented foods. The other group of foods I want to talk about, which are so popular lately, and it's really an old food that's been brought forth, is bone broths. Have you heard of bone broths, Mark?
No. Just chicken broth and so. No, I haven't heard of bone broth.
So as you brought that up, chicken broth would be one of them. There's probably the most scientific information on why does, in the Jewish tradition, chicken broth is sort of looked at like a penicillin if you have colds and flus. And there's ingredients in chicken broth which help heal the mucosa of the small intestine, which is where we pull out nutrients, which is part of why we feel so much better when we get that nourishing broth in us. So that would be an example of one of those such broths. So the way the bone broths would be made would be you would be starting with a whole chicken or chicken that has bones in it, like chicken legs or chicken wings. And the important piece is that you have something acidic like vinegar or wine or tomato. The acidic property breaks down the bones and the marrow. If you can use pliers and break the bones, that even makes the marrow more accessible. So what it is we're trying to access in this case, chicken broth, is the marrow of that bone. That marrow is an essential nutrient to keep our bones healthy and keep our joints healthy. So the bone broth extracts that. I heard recently there's someone here in town, I think there are a couple of businesses that make bone broth like for a living, like they deliver it to patients. I've got a couple of patients who are undergoing chemotherapy, and when you undergo chemotherapy, one of the big challenges that I'm often called upon for is their bone marrow gets compromised by the medication, so their blood cells diminish greatly, and if they go down too low, then they can't take their next chemotherapy. So bone broth is one of the things that I will suggest, and it's wonderful how fast it can improve the blood cells, red blood cells and white blood cells. So bone broth is really it's a lovely thing. So then once the soup has been, the bones have been cooked, you could have included vegetables in there, like carrots, like you're making a soup stock. And as it has completed cooking, you strain off the broth. What I do is I put it in the refrigerator, and once the fat comes up to the top, I scoop off the fat, and now I've got my bone broth. So this would be my cooking water that I may use for many different purposes.
Okay.
Okay? There's a couple of other traditional soups that are utilized for their high mineral content. If there are some vegetarians that are listening that are wanting to make some kind of a nourishing soup to keep their bones and joints strong, and they don't want to use any animal foods, one that comes from a European tradition is kale and barley. And you do a long cook with the kale and barley, and you could season it as you need with salt. And then one from the Oriental tradition would be to cook together any sort of bean and seaweeds. So that combination would also be a very easily assimilated kind of high mineral soup.
I have a question. You mentioned fermented vegetables a while back, and sauerkraut and kimchi. But what are some others? Because somebody listening, well, me for that matter, might say, "Well, I would like to do that," but what are some common fermented vegetables?
If you've been around Chinese families, you'll find that Chinese or Japanese families, they usually have pickled vegetables as part of the meal. Like in the macrobiotic tradition, daikon radish is made into a pickle. You know dill pickles. That's a kind of that's a kind of a fermentation that's usually done with vinegar. Most of the fermented vegetables that I've been utilizing recently are not fermented with vinegar. They make their own vinegar with just salt and water.
Okay.
So, one of my friends makes this delicious one that is cabbage and cauliflower, and it's really got that nice crunch like the cauliflower has.
Mm-hmm.
I have one that I purchased at the store recently that's cabbage, lemon, and ginger root, and it's delicious. A little spicy with the ginger.
Okay. It sounds it.
Yes. So there's many different vegetables that can be fermented and made into a sort of a kraut.
Okay.
Another thing I wanted to mention before we conclude, I'm not sure how much time we have left, is that there are a couple of supplements that may be of help for the joint, knee pain, hip pain, when there is erosion of the cartilage. It's going to take some time to build that cartilage back up. That's part of what the bone broths are doing. But taking gelatin may be another supplement, like Knox gelatin.
Mm-hmm.
That would be another supplement that will help build up the cartilage. And then you've probably heard of glucosamine or chondroitin. They're often glucosamine. They're often put together in a supplement to help rebuild the cartilage in your joint. I think shellfish is the most common source of that chemical. But the one that I've found the best results with is one that I get it at Costco. It's called Cosamin, Cosamin, Cosamin DS. And I actually first got it because Ginger, my pit bull, had a knee problem, and it cured her. It didn't cure my hip. It helped my hip a little, but it didn't cure my hip, but it cured Ginger. So it's a good supplement. And then the other thing for those suffering with joint problems, there are some fabulous topical remedies that you could get in a Chinatown store or in a natural food store. White flower oil is one that's very good when there's inflammation. It has peppermint and lavender in it. There's a liniment Zengu Shui. It's in a red box. You see that. Pretty much all health food stores sell that. It's good for knee pain. So it's probably a good idea to explore. Some of those topical liniments will help reduce the inflammation, which is, if you're feeling pain, it probably has to do with the fact it's inflamed.
Does movement help at all, or does that exacerbate?
Yes. No, I'd say it's important to keep moving so you get blood flow through there.
Okay.
But at the same time, pay attention to how much movement is the right amount. I find that if I go either extreme, either couch potato too much or too much activity, either one can cause more inflammation in my hip. So just pay attention to how do you feel an hour after your activity. If you're worse, then it was probably a little bit too much.
Okay. Well, Cathy, I'm glad we talked about this one, and I think the weight is certainly it's near the top of my list, getting 25 or 30 pounds off of me.
A few days ago, I hit my lifetime, I think, goal weight. It's been my goal for like 40 years. And I was like, I got there and I thought, I thought I would feel like different. You know what I mean?
Yeah.
I feel fabulous, but it meant nothing. It was a number, except that, finally my driver's license is no longer a lie.
Yes, well, that's good.
Yes.
Thank you for another great health chat, and we'll have, I think we'll try for one a month.
That sounds good.
Yeah, we'll have that's another good topic the next time, so thank you.
You're welcome.
Have a good night.
Okay.
Bye.
Bye, Mark.